will start with our CMO address first, and we'll see what she has to say today to us. I haven't watched this video either, by the way.
Good morning. I am very pleased to welcome you all to the third National Fracture Liaison Service Conference. This event has become an important forum, bringing together clinicians, policy teams and partners from across Wales who have a shared passion to improve lung health. I thank Dr. Singh very much for inviting me to join you today. I am very disappointed that I was not able to join you in person due to an unavoidable issue. And I am very disappointed because I wanted to celebrate with you the excellent work of the Fracture Liaison Service and thank you all very much for your hard work. Today provides an opportunity to take stock collectively, to reflect on progress, to share your experiences and to think about how to best strengthen our services going forwards. By identifying and meeting the needs of people who sustain a fragility fracture, the All Wales Fracture Liaison Service is reducing the risk of further fractures, reducing the loss of independence and making more effective use of scarce NHS resources. We must not miss opportunities to prevent devastating fractures and their consequences. This work is about preventing avoidable harm, about reducing the impact of fragility fractures on people's independence, on their well-being and on longer-term health outcomes. So this is really important work, and I want to start by thanking Inder and his team for convening today's conference and for his excellent leadership and commitment in driving further improvements. I also want to recognise the work that's being done across the whole of the NHS in Wales, where teams are embedding this preventative approach into routine care and strengthening pathways for patients. This represents a significant collective effort across the system, so thank you. It also reinforces an important point, that progress in this area depends on a coordinated end-to-end pathway approach rather than individual services working in isolation. You will probably be aware that the new government has signalled an emphasis on prevention and improving population health. This is really what we need to transform health outcomes for the people of Wales. I also welcome the government's renewed commitment to the Community by Design programme. This programme will transform how we support the people of Wales to meet their needs in a way that is much more effective and to create a health system that is designed around people and their needs, not around the institutions, helping them to remain well and independently in their communities and supporting them to manage their own health and well-being where possible. We will also be developing a new model for how we manage chronic conditions in the community. And osteoporosis is a chronic condition. The Fracture Liaison Service is a very strong example of the preventative and integrated healthcare approach that we are seeking. Identifying risk early, intervening at the right time, and reducing the impact on individuals and the wider system. The Fracture Liaison Service has achieved a lot already, and huge congratulations to you all. But we are ambitious for Healthy Wales. And there is a clear national ambition for Wales to achieve the 80-50-80 standard by 2030. So in practice, this means that we need to continue to improve how we identify fragility fractures, to ensure appropriate treatment, and to maintain follow-up over time. There is great progress, and thank you, but I would ask you that we renew our efforts to improve consistency and to continue to strengthen quality across Wales, particularly increasing our focus on that longer-term follow-up, because outcomes will depend on sustaining engagement with treatment over time. So I am very pleased to see the launch of the new Community Health Pathways for Osteoporosis and Falls Prevention and Assessment today. This also represents an important step in shifting care closer to home. It does reflect the principle of community by design, ensuring that services are shaped around people's needs rather than organizational structures. Improving outcomes in bone health requires a proactive and coordinated care approach across primary care, community service and pharmacy, particularly for older people. So achieving these ambitions that we have, which are so fantastic and important, will depend on perseverance, on sharing learning and on reducing variation. This conference provides a fantastic opportunity to identify what's working well and to consider how we can apply it more consistently. So please do make the most of this opportunity and apply the learning that you'll gain today to strengthen delivery locally. I hope you will go back home with renewed energy and enthusiasm for this important work. So thank you all very, very much for your continued commitment. I hope you really enjoy the day. Liaison.